She trusted them with her life. She lay on that cold operating table, vulnerable, hoping for healing. But what they left behind inside her would almost kill her. This is the haunting story of Monica Taylor, a wife, mother, and fighter who survived what no patient ever should. Monica was 38, energetic, and full of life. A small lump in her lower abdomen had been bothering her for months. Doctors said it was a benign growth, nothing to panic about, but they recommended laparoscopic surgery to remove it. She agreed. It was supposed to be routine. She kissed her daughter goodbye that morning, told her husband she'd be back home in 2 days, and walked into the hospital with confidence. She was wheeled into the operating theater at 9:15 a.m. The surgery took just over an hour. Monica came out drowsy, in pain, but alive. The doctor smiled and said, everything went well. She had no idea that they had just made a mistake that would haunt her for years. A few days after being discharged, Monica started complaining of sharp, stabbing pains in her side. At first, she thought it was just normal post-op pain. But the pain got worse. Her stomach began to swell. She couldn't eat. She couldn't sleep. She felt weak. When she called the hospital, a nurse told her it was probably just gas or muscle spasms. They told her to take painkillers and rest. But Monica knew her body, and something was deeply wrong. By the second week, she was back in the emergency room. The ER doctors were baffled. They ran tests. Blood work showed elevated white cells, a clear sign of infection. A CT scan was ordered. And that's when everything changed. The radiologist paused. He called another technician in. Then another. They saw something that wasn't supposed to be there. Inside Monica's abdomen, next to her intestines, was a surgical sponge. It had been left inside her body during the operation, 2 weeks ago. It had started to rot. Bacteria had spread. Her internal organs were inflamed. Her body was going septic. If she had waited another 48 hours, she might not have survived. Monica was rushed into emergency surgery. This time, it wasn't routine, it was life or death. The doctors removed the sponge, flushed out the infection, and placed her on heavy antibiotics. She stayed in the ICU for 4 days. When she woke up, she was confused. Angry. Betrayed. No one had told her what happened. It wasn't until her husband demanded answers that a junior doctor finally admitted. The surgical sponge wasn't counted properly before the wound was closed. At first, the hospital promised to take responsibility. But then the attitude changed. They claimed it was a rare complication. They said it wasn't negligence, it was a miscommunication. Monica's requests for her full medical records were delayed. Pages were missing. Dates didn't match. It became clear they were trying to cover it up. She sought legal help. The case dragged on for months. The hospital's lawyers tried to intimidate her into silence. But Monica wouldn't back down. She wasn't just fighting for herself anymore, she was fighting so no other patient would go through what she did. 2 years later, Monica finally got justice. The court found the hospital guilty of gross negligence. The surgical team had failed to follow standard operating procedure. There was no proper count of the tools before closing her up. Worse, there were no protocols for double-checking during shift handovers. She was awarded a settlement, but no amount of money could undo the trauma. The fear. The months of pain. The anxiety she still carries before every doctor's visit. Monica now speaks publicly about her story, warning others to always ask questions, demand clarity, and never assume hospitals are infallible. Monica survived. But many don't. Every year, thousands of patients suffer in silence due to medical negligence. Some die. Some never find out what happened. Some, like Monica, choose to speak out. Because silence protects no one.